everybody, and welcome to our webinar on self-management, the future model of community care. So to begin, just a couple of quick housekeeping notes from me, then we'll get into what the session is going to focus on and introduce our panellists in a bit more detail. This session is being recorded and a member of the HTN team will be completing a write-up of the key discussion points afterwards. So you will be able to go back and catch up on any points you might have missed or share with your colleagues if you would like to. Secondly, you are very welcome to ask any questions or share any views that you might have as we're going through the webinar. We're hoping to leave some time at the end for a bit of an audience Q&A, so please do feel free to get involved. Moving on to the focus of our session today, to give you a bit of context. So obviously, as we all know, community care is at a bit of a breaking point, largely because of our ageing population. Demand is outstripping the system's capacity to deliver, and hiring more staff isn't a feasible option because of the financial constraints facing the NHS. However, there is a solution in supported self-care. So despite a number of attempts, the concept of supported self-care hasn't really been successfully implemented at scale yet within the NHS. That's what we're going to be discussing in the session. So to begin, I think if we have some introductions and we hear a bit more from our panelists about their role, their remit. So Steph, can I come to you first, please? It'd be great to hear an introduction from you, your experience on how the concept of self-care has evolved in recent years and your view on why it's important for a healthy community.
Hi, thanks for all coming on this call. I think it's brilliant that we're finally talking about self-management or self-care, as many people also allude to. So I'm Steph. I'm a self-management specialist working across the whole country, including Scotland and Wales, in regards to delivering self-management training. So I've actually done self-management for 9 years in various projects, which puts me in this really amazing role of being able to deliver education around it now. So a bit of background about myself is 4 years ago, I set up a team in Leeds, solely working on self-management techniques, working with individuals to promote independence for any clinical task. And I had a team of 5 back then, which has grown to 47 with permanent roles. And we'll go on to in a minute the achievements that has created. So I think obviously self-management is really important. I think we need to all understand what we talk about when we say self-management. What we're really saying is we talk about personalised care. So it is so important that we kind of switch this ethos and kind of use self-management as personalised care approach, because that's what we're talking about. And yes, it is super easy to achieve. I know a few people popping up on this call today have had talks with me before and are up and running with self-management already. I was lucky enough to deliver training to Calderdale last week, and within hours they were messaging me going, this is amazing, it's working. And I think self-management is, my passion is on the individuals that we work for, the clinical task, giving them back the independence, giving them a reason to continue to live and keep well, but also the morale of staff. I think that's really important that we kind of boost the morale of staff, because we all come to work, we all want to make a difference, and it's really hard when we have 1,000 visits a day to go through. Next slide.
Absolutely, thank you for that. Charlotte, can I come to you next and ask the same question? So can you introduce yourself, tell me about your experience with self-care and why it's important for a healthy community? Have we still got Charlotte with us? I think we might have lost Charlotte there for a moment. Dee, I know we've been having a few technical problems with your headset. Are you having any luck with that one? Can you hear us? No, not sure. Not to worry, we can come back to some introductions. I think, Steph, if we just keep the conversation going with you, and then we can pick up from Dee and Charlotte after. Oh, Dee, can you hear?
Can you hear me?
Yeah, we can hear you. We got fantastic. We got there. So welcome. Thanks for joining us. And can I come to you with that same question that I've just put to Steph? So if you could introduce yourself, tell us about your role, your organisation, your experience of self-care and why it's important. Oh, I think we might have lost you again. Steph, can you hear Dee speaking? You're on mute.
No, I can't, unfortunately. No.
So, oh dear, we'll keep trying with that one. Apologies for the technical hitches, everybody. Steph, as I mentioned, I'll come back to you on this on a few questions whilst we
Right.
sort out the technical hitches in the background.
Perfect.
So, I think a good place to start would be, what support structures do you think are needed for successful self-care implementation?
So I think first and foremost is education. So we have so many different assets and clinicians across the whole of the NHS, and we need something that can be transparent through all them roles, because we know that we're not getting through nursing staff as much. So actually there's so many roles out there that have so many assets, and delivering education to kind of implement self-management in all of them roles is the key. And I think obviously the digital aspect of it, which hopefully Charlotte will come back and talk about, is really key as well, because I think as we're moving towards that digital platform, it's really important that we have a very clear, sustainable approach to that, but also not just for us as clinicians, it has to work for the individual, because we aren't going to be with an individual 24 hours a day. So whatever we implement on self-management, we need to make sure that that person-centered approach is the beginning of that journey.
No, absolutely. I think we've just lost Charlotte again, unfortunately. I think we might be having some internet issues there. So I am going to stick with you, Steph. Steph, apologies for putting the spotlight on you. What is your view on ensuring that self-care doesn't exasperate health disparities?
Oh, Charlotte's back, so I don't know if she wants to come into this.
Yes, that
now.
would be great. Let me just get my question back for you, Charlotte. So you didn't get the, oh, has she gone again, or is she there?
I'm still here.
Still
I
here.
think.
You're still here. Fantastic.
Hello.
I don't think,
Hi, everyone.
hi. I don't think you got the opportunity to introduce yourself, did you? So could you
Sure.
tell me about your experiences with self-care and your views on why it's important?
Of course. So hello, everybody, and thank you for bearing with me there. Really thrilled to be joined by a fabulous panel and have the opportunity to discuss the importance of supported self-management. So an introduction to myself and to Isla. So I'm Charlotte, I'm partnership lead at Isla Health. My role at Isla is to work with organisations to adopt and scale Isla's technology. And a little bit about me, I've been working with NHS organisations in commercial partnership roles for around 12 years now. And during that time, I've been lucky enough to work with teams to implement new models of care delivery, including supported self-management. So very quickly, for those of you who haven't been introduced to Isla Health before, I'll share a very quick top-line overview. So in just under 4 years, we've experienced significant growth and now partner with around 30 plus NHS organisations. And what's really kind of driven that is the lovely unique thing about Isla, which is the fact that we're completely specialty agnostic and we can be used right across the care pathway. So all the way from waitlist management validation, all the way through to the other end of the patient journey. So safe and effective discharge. So a really kind of quick introduction as to Isla as a platform. So Isla is a web-based platform that provides a tool for enhancing patient monitoring, really, and it uses functionality to facilitate the exchange of high quality visual data and forms between patients, clinicians and their wider care unit. So in response to your question, Amy, I thought probably the best place to start would be from this quote from NHS England, which let me just check it's on. It is fab. So I'll share this with everybody, but what I really think that this quote kind of brings to us today is it kind of really sets the scene for today's discussion and underpins really the enormity of the opportunity that I think we all have to make a significant impact in not only addressing the extreme kind of capacity challenge faced, but also to patient care outcomes. So I'll read the quote out for us all. So supported self-management is arguably one of the most underutilised, evidence-based, cost-effective health interventions available to the NHS, which I think is really kind of significant statement there. And kind of pinning back into some of the pieces that Steph was sharing when she was sharing her introduction, supported self-management is one of the 6 core components of personalised care. So I suppose to bring that into my side as a technology partner and to kind of open the discussion is in where does technology come in to support with addressing some of these challenges. Technology, we believe, can be used to adopt the supported self-care model and really enable scalability and sustainability of the model. So all of the great work that Steph was sharing with us, and Dee will be kind of joining in on that. How do we ensure that that keeps moving and we keep being able to achieve those great outcomes at scale? And I think that technology does this by addressing 3 of the core challenges within this space. So the first one is reducing risk. So, how do we use the technology to digitally monitor and engage with patients remotely while they are self-managing, and really supporting clinicians to be confident to move their patients onto a supported self-management pathway. And we do that by ensuring that clinicians can see exactly what's happening with those patients at home while they're taking on those clinical tasks. So an example of that might be your patient is changing their own wound dressings and they're taking care of their own wound and kind of on that wound healing journey. The clinicians would then be able to see and monitor any changes within that wound progression. So if it's deteriorating, if there are any improvements, that kind of then reduces that risk or that fear, I suppose, or improves the confidence of the clinicians to be able to move their patients onto a supported self-care pathway. The second part is how do we use technology to really extend the reach? So there's a few pieces that kind of sit within here. So the first piece is patient identification and enrolment. So how do we use technology to make sure that we're finding all of the suitable patients and supporting their enrolment onto a pathway, and kind of using everything that we have within our layers of technology, to make that as seamless as possible. So that might be, putting the patients into the system, engaging with the patients, making sure that everybody is kind of, up to speed and kind of well looked after within that space. The second part under extending the reach is how do we broaden the scope with patients? So to make sure that we're reaching as many patients as possible with a wide range of conditions to be able to be moved on to a supported self-care pathway. Supported self-care doesn't have to be just for wound care patients or just for patients who are administering their own insulin or patients who are doing their own eye drops. It really can be, and Steph will be able to really kind of bring some light to this, but to be for as many patients as possible. So we can ensure that the tech that we're developing can support a real kind of wide range of conditions and make sure that self-care is really kind of truly specialty agnostic by doing that. And then the kind of the next part of extending the reach is making sure that we're really broadening the cohort. So making sure that the clinical teams have got confidence with remote engagement and monitoring to move as high volumes of patients as possible onto a supported self-management pathway. And we can do this by making sure that we're kind of having that the technology is doing a lot of the hard work, feeding that information in, to the clinicians and giving them quite a light touch to kind of manage that piece. And as well as extending the length of time that patients can self-manage for. So an example of that might be, without remote monitoring or remote engagement, you might have a patient who you would feel confident to move on to a self-management pathway for maybe 2 weeks. But actually, if we can now start to see what's happening remotely with that patient, we can engage with them remotely and we can kind of monitor from afar what's happening with that patient at home while they're taking on their own clinical task. We might be able to extend that length of time that patients can self-manage from 2 weeks to maybe 4 or 6 weeks. So really ensuring that we're getting the most out of the capacity release, but actually improving that patient quality of life and outcomes as well for the patient. Then the third piece, I think, where technology can really kind of be used to adopt and support supported self-care model is making sure that supported self-management pathways are really low friction. So it's easy for the clinicians to onboard. We can streamline the operational and clinical flow, and that might be, preventing the need for clinicians to have to make phone calls to patients or patients having to trying to find, phone their clinician in because everything's kind of happening remotely within the background, or, reducing the paper-based pathway. So just really making sure that it's as low friction, as simple as possible. So then just to finish off, I suppose, on my introduction piece, if that's okay, Amy, just to kind of take a look at the technology as a tool and how we can now start to understand the different functionality and capability that we can, we can use to support self-management in practice. So the delivery model is really underpinned by these 3 key areas. So we've been working really closely with Steph to understand what the kind of delivery model would need to be and how do we then support that and bring that to life with technology. So it kind of falls into 3 key areas. So the first being patient enrolment. So using technology to support demographic and clinical indication-led caseload assessments to identify the patients who would benefit, but also then turning that on its head as well. And how can we actually engage with the patients to do a patient-led patient-led self-assessment to ensure patients are supportive of that approach moving in. So that could be patients engaging remotely, filling out a form to say, yes, I'm keen, and these are clinical tasks that I might want to do, whatever that might be. So the second part then is onboarding and monitoring. So again, as I mentioned, we've partnered with staff to deliver the self-care training program to support all of staff teams within our partnership, which is fantastic, and then use the tech to support patient engagement and confidence and competence to make sure that when patients are on these self-management pathways, they are still feeling engaged with, and they've got all the information that they need. So that could be, for example, a explainer video of how to perform the clinical tasks. It might be sharing digital leaflets or how-tos. And then the third piece, I suppose, within the onboarding and monitoring is all around remote monitoring of patients on a supported self-care pathway. So clinical teams can monitor any condition changes, really, really simple and continuously within Isla. Then the third piece where the technology can support the pathway, and this is where I'll kind of wrap up, is around the benefit realization piece. So now we have all of these pathways running and all this information that's being collected and used really effectively within a digital platform. We can then start to use that to really understand where we're making some benefits here. So, we can see significant reduction in visits and self-care approach for clinical tasks. So for an example, from some of the work that Steph's done, saving anything between 2,000 to 3,000 visits per month by engaging and empowering patients to take on their clinical tasks. So we can really report within that and track those changes. But also we can use the technology to understand where it's working, where it's not across a whole area. So some localities or teams might be brilliant. We've got 30% of the caseload self-managing here, and other areas that might be completely different. So we can really then start to kind of understand impact and change and then make any changes. So I hope that's okay. Share some kind of context around how the technology is supported. I'm looking forward to the rest of the discussion.
No, absolutely. That's really useful to help us frame the discussion as well. So thank you for that. Dee, can I check? Have we had some luck with your
Am
audio?
I here? Am I coming in loud and clear?
Amazing.
I am so sorry, everybody.
No worries at all. No worries at all. It happens. It happens to all of us. We're just glad to have you with us now. Can I pose the same question to you? So could you introduce yourself, tell us about your experience within this space, within self-care, and why do you think it matters?
Okay, thank you so much, Amy. Again, apologising for the technical issues. Having been my name's Dee McMullen. I'm a senior district nurse for Leicestershire Partnership Trust working in Rutland. I've been in the district nursing service or community nursing service for 20 years-ish plus. And as you can imagine, over those 20 years, I've seen a lot of changes with what is expected of a district nursing, community nursing service. And from my point of view, we can never be full. We can never say no. We can never push, say, I'm sorry, we've got to our capacity. We are unable to take on any more patients. We are completely open service. So with that in mind, we need to be making sure that when we are taking on our patients, that we take them on correctly, take on the patients that need us the most and the patients that need one-to-one care rather than something that they could cope with themselves. Now, I've spent a bit of time over the last year looking at what people expect from community nursing. And a lot of the time, it's just reassurance that they're doing the right thing, that everything's fine, that they're not going to deteriorate with sepsis, that they're not going to get pneumonia out of something. And maybe sometimes all they need is to send us a picture so that we can phone them back and say, yeah, or message them back, looks good, looks fine, you're doing a grand job. It's empowering that patient that everything is going to be okay as much as we can promise it will be. Now, there's always going to be the situations, isn't there, where, we do have to take over, we do have to take control, we do have to monitor them more closely. And that doesn't mean, again, taking it away from them. That just means it might just need a little bit more input, like a photo twice a week or a video call twice a week. Now, the ideal option would be to get more nurses. For LPT, I was looking at our vacancy factor last night, and we have 100 whole-time equivalent vacancies within LPT. And I spent the whole of Tuesday interviewing nurses. I recruited 2 out of my whole day working. So the answer isn't going to be more nurses, because there isn't more nurses. So let's use technology, empower patients, push back for these things like skin tears, where, you know, as a 40-year-old and you'd had a skin tear, you'd sort it out yourself, you'd put a plaster on and see you in a week if it hadn't healed. Let's empower patients back into their health, their well-being, encourage them to seek advice where necessary, send us a picture, we'll have a look, we'll assess it, we'll give you a treatment plan, we'll advise you where you need to go. I've got an example of a patient who is 85. He's been on our caseload for several years, and we've been going twice a week to sort out his wound. He wanted to be able to have a shower every Monday. So from now on, we send him a link via Isla. He takes his dressing off, he has a shower, he sends us a picture, and we don't need to go and see him because he'll put his own dressing back on. So we've got him down to once a week now. And do you know what? This little chap feels like he's got his independence back, even if it's just that one day a week, just to be able to turn around and say, do you know what? I'm a guinea pig. I'm using technology. I'm embracing technology. And, you know, and look, my wound's healing. And the photo journey for this gentleman is outstanding, just to see the improvement of his wound. So, yeah, I think we don't need to fix nursing. We need to fix what we're looking at.
Mm-hmm. That's fantastic. Thank you. Can I, now that I've got you, can I stay with you for a moment, Dee? Because I'd like to pick up on a point that you made there about empowering the patients and looking at the other side with regards to clinicians. So what would be your view on how we can support clinicians to gain the confidence to move patients onto these pathways?
I absolutely agree. I think nurses are always afraid of being discharging people because they're worried that they'll be blamed, something will go wrong. If we don't keep hold of these patients, something's going to happen. So yeah, we do need to empower nurses to give them permission to say it's fine to get these patients self-caring, that it's absolutely what we should be doing, so that they feel confident and that they won't you know, feel like they could be blamed for anything moving forward. I know what it's like. I mean, you know, you say to looking at my nurses here, they'll say, oh, well, he could look after himself, but I'll just keep an eye on it because I don't want to let go. But Isla helps with that because we can still keep an eye on it remotely. We can still take a photo. We can still have a look at it. We're still able to give advice and changes of care. The patient's not on their own still. We've still got that clinical oversight. We can send GPs photos and, you know, link in with your GP and other MDT services to actually promote what we're the care pathway for this patient. And I think, you know, the more we use it, the more staff will become empowered themselves to actually push forward with self-care. They're just so nervous at the moment. I think if it comes from everywhere that self-care and empowering patients is a good thing, then they'll embrace it.
Absolutely, thank you. And flipping it back onto the patient side, Steph, can I come to you and ask, how can we ensure that self-care doesn't have a negative impact on existing health disparities?
So I think it's really important, and I think some people have been watching the chat as we're kind of looking at this. Just going back to when we talk about what self-management means, this is why it's so important to educate around what it means. So self-management is a term, an umbrella term, but it is made up of, I call them triangles, and the bottom triangle is personalised care. So you will not achieve self-management unless you understand the individual you are walking into work with. And that could be podiatry, that could be stroke, that could be diabetes, that could be acute settings, primary care. And this has all been tested in 5 NHS organisations now, and it really does work. So when we talk about health inequalities and things like that, you would not achieve self-management if you haven't understood the individual. So I will share a quick scenario of a gentleman we worked with who had diabetes. He was a gentleman who was discharged from hospital 3 times a day, newly diagnosed diabetic, on 3 times a day insulin with a learning disability. So he came through to district nurses. Absolutely, we're all sat in this call going, absolutely, there's a clinical risk there. He's coming through to district nurses. That's exactly the right route for him. I went to go see this gentleman. He said, I just want to die. Now, a majority of us on this call will have gone through this to individuals that we see. And I said, oh my goodness, just tell me a little bit more about that. He said, I can no longer go to the day centre to play Star Wars with my friends because you are coming in 3 times a day to do my insulin. And I said, right, just tell me a bit more about your insulin. And, you know, we had a conversation. It is no more than a conversation is self-management. And there are elements to it, which is why it's so important to have training where you manage the risk within that conversation as a clinician, but you're empowering the individual and giving that individual time to talk. So we worked with him for a little while, and he picked up this piece of paper and he waved it in my face and he went, and I've been discharged with this. I've been sent home and I can't read and I can't write. I mean, how many times do we send out leaflets and booklets, and how often do we ask the person, is this the right thing for you? Whereas if we can have an app or something that will say, what is the best way for you? It would change the whole direction of that care. So I ripped the piece of paper in front of him and I said, don't worry, I have a plan. And we've got to be very clear. I am not changing the information we are delivering to him. I'm not changing that. With the same clinical education is being given, but in a format that he understands. So AM was changed to a sun. Lunchtime was a sandwich because he said that he wanted a sandwich for lunch. And the PM was a moon. So we are just changing the way we deliver the care. So when we talk about health inequalities and disparities and things across the board, you would not achieve self-management unless you've understood who you're working with, because it has to be sustainable. And what we don't want to do is pull out of it and then that person end up back on the waiting list. And someone's just said personalised care, not self-care. Well, actually, if you don't achieve personalised care, you can't achieve self-care. It is the whole model of self-management, and it's the model that I am delivering across the whole of England at the minute, including universities. So it has a big impact.
Absolutely, thank you. And linked into some of those points, Charlotte, I'd like to come to you with a question. Also on the disparities note, how can tech be used to address potential limitations for patients who might not have particularly high levels of digital literacy, for example?
Yeah, brilliant question, and something that we're quite passionate about actually at Isla. So we've done a huge amount of research and work within this space to ensure that our technology is easy for both patients to use, but also clinicians as well. And really, kind of the underlying message is, if it's not easy for patients to use and engage with, the pathway is not going to work. So what our findings, have really kind of shown us is that to achieve high levels of patient engagement across really broad caseloads of patients, we need to make the digital flow as low friction and as simple as possible. So some of the things that we've done within that space is to access Isla, the patients don't need to download an app onto their phone. It's a web-based app that they can access. This makes a whole world of difference because it means you don't have to have a special level of phone. You just have to be web-enabled, and you can kind of access that through an encrypted link that will be sent to you by your clinician. So it's really simple. You open up the link and off you go from there. So that takes the first big barrier down. The second barrier is, how do you then access that? And what we've really found with lots of our kind of research within this space is that asking patients to remember a login credential or a password, and I know I'm definitely guilty for this as well, can really kind of then floor that process as well. So we have a really simple flow where the patients can access the web-based app for them to respond into by just entering their year of birth, and that is enough approval for you to then open through and access in. What this is then really kind of achieved for Isla and for all of our partners who are using Isla is that we have market leading patient engagement rates because it's very, very simple for the patients to then kind of engage and come through. The second point around this is kind of very much coming back to some of the pieces that Steph and Dee have brought out, is understanding that patient specifically and their individual needs when it comes to digital literacy. So it might not be that it will be the patient who will receive the message from the clinician and will be responding. We might need to be engaging with a carer, a family member, a neighbour, or whoever that might be. So within Isla, we can set, different levels of phone numbers or contacts within Isla, who's going to be that, ID approved, I suppose, person who's going to be then responsible for sending that information back in. So there's kind of lots of ways that we've, really tried to ensure that it's a process that as many people as possible can engage with, and our kind of results within this space is kind of proving that it's working. We've also done lots of work on our kind of accessibility piece as well. So our product and design team have led a huge amount of work and research into how to make our the actual view and the use of Isla as broad range and as open to as many people as possible. So we're very close to becoming AAA accredited within that space.
Fantastic, thank you.
Thank you.
Dee, I've got a question for you, because I think one of the points that keeps coming up from all of you is that it all comes back to the patient. It's all about the patient, and they are very much at the heart of this. With self-managing and self-care, how can we ensure that patient safety and quality of care continues to be at the highest standard if we're on this pathway? Could you share some views on that, Dee?
Yeah, I think from the pathway that we've been using with Isla, all the photos that that get submitted to us are reviewed by senior clinicians to make sure that the patient is on the right pathway for them, or whether it needs to be escalated and whether they're deteriorating. It's actually highlighting risk earlier than it would have been if we were just seeing them once a week, because we have the ability to capture an image at any time rather than just waiting for your next visit. So if the patient's worried, the carer's worried, the family member's worried, then an image can be sent through immediately, which then captures that deterioration earlier. Because their visit might be not until the following Friday, but on the Sunday the battery is showing signs of deterioration. And it might be the fact that yes, would have phoned in, and probably yes, they would have had another visit, but it also might lead to a change of treatment. Do we need to talk to the GP earlier? Do we need to have a swab? Do we need to look at antibiotics? But that's actually happening now sooner than it would have done if we'd just relied on just going to the visit once a week.
Brilliant, thank you. Charlotte, can I come back to you about a point that you made earlier about broad patient loads? So how can tech enable self-care pathways to be adopted and scaled successfully across patient caseloads?
Sure. Great question. And actually, this is something that we've been working really, really closely with Steph and our clinical and operational leads, such as Dee, to really understand how we can kind of use the technology to support, but also solve some of the key challenges faced with regards to not only the adoption of supported self-management, but also scaling the pathways and ensuring the sustainability of the model. So to make sure that all of the great work that the clinical and operational teams have worked so hard to embed and to adopt, then remains embedded. So I think I kind of touched on this a little bit within my introduction, but just to bring more light to it. So I think the key things that we've really learned from Steph is, how can we use the technology to reduce the risk and ensure the quality remains. So the clinicians are not stepping away from their patients, but the patients are then taking on that clinical task. How can we ensure that the actual the the outcome in care is still being, is still at the same level. So we're still seeing, I don't know, wounds healing in the same rates, potentially better. We're seeing higher engagement for insulin, eye drops are being done, whatever that might be. So we can really kind of achieve that with using digital, because it means that we've got remote engagement happening and remote monitoring happening. We can also provide a really safe and secure way for communication to be happening between clinicians and their patients and their wider care unit, because we never would want the patient to feel, I'm doing this clinical task now, I'm now alone. So the technology really facilitates, and that makes that communication piece much easier for the clinicians, and also easier for the patients to feel like they're being monitored and cared for, even if they're not having a face-to-face intervention with their clinician at that time. And then I suppose identifying, kind of using the technology to identify where supported self-management is working. So, we might be able to be all, delivering care, running our services, but actually to have a piece of technology which is bringing in and I suppose sharing all of the what's actually happening out there across self-care pathways. So are we seeing, healing rates improving? Are we seeing capacity being released because of self-care? So we can really kind of track where that's happening across, the care system, and it can really help us understand local needs as well, but also pick up really quickly where changes might need to be made to ensure that self-care is, being successful at scale.
Fantastic, thank you. And keeping on the note about adoption, Steph, can I come to you? Do you think there are any key misconceptions or reservations that people tend to have about adopting self-care, and how can we tackle these?
Yeah, so I think, I've been in the NHS 15 years, so I'm very aware of what we all go through on a daily basis. And I think when I go to a lot of conversations and talks, it's mainly about that risk. So as a clinician, you are so fearful of the what ifs. We call it the what if conversation, self-management. And all I can say is, once you've had the training and kind of understood it, and you start to see a difference in the patients, you then realize actually it's not a scary term. We're not talking about anything scary, and actually you probably already do it, which is the great thing. It's just having a model to it sometimes will just give you an extra bit of, oh, I am doing something that I'm meant to be doing. And we know that NHS England is pushing this, and they have brought out models around self-management, self-care, shared care, lots of different terms. So we are pushing it, and we know that the benefits are massive for the patients as well as staff and organisations. So on average in Leeds, we were discharging around 200 people every month and saving 3,000 plus community nursing visits and reducing bed stay by 4 days on average from the acute trust in the community. It has a massive impact, and the people in the middle of this who we're delivering care to are getting the care that they want, and they understand, and they're more than likely, if they get their touch wood, they don't, but if they go and fall again, if they've had this positive experience of self-management and being included in their care, they're probably going to manage that much better than deconditioning in hospital and things like that. So I appreciate the fact that the risk element is so scary. It's probably the initial things as well. We're here because we care, and actually that's our job to do that. Absolutely. What we're not doing is taking that away. We're just delivering it in a very different way. And I've had matrons who have been on the verge of retiring that have turned around to me and said, I feel like I'm a nurse again, coming back to do the nursing that I originally came into this profession for 40 plus years ago. So yes, I appreciate that the risk is probably the biggest fear factor, but when we underpin that under self-management, trust me, it's brilliant.
Fantastic, thank you. Some great points there. We've got about 20 minutes left to go. I do have a question that I'd like to put to all of you, and then I'd like to leave a bit of time because I know we've had some questions and comments come through in the chat. But lastly, Charlotte, I've just got one more question for you. So with regards to Isla's tech, how can it be integrated within existing healthcare systems to support things like data sharing and patient care coordination, for example?
Yeah, absolutely. So this is something that's really, really important, isn't it? We want to, at Isla, we really want to make sure that we're not asking clinicians to take on another job. or another piece of reporting that they need to do, or another system that they need to be kind of now engaging with. So everything that we've done with the development of Isla is to make sure that we're reducing duplication, and it's easy for clinicians to engage with and kind of use as part of their everyday toolkit. And a real kind of key part of that is making sure that we have really solid integrations with EPR. So the EPR is always going to be used, and it's going to be kind of like the baseline, and I suppose the bread and butter of everything that we're trying to achieve. So how does Isla then work alongside this to kind of supercharge that that kind of technology that you have with your EPR already? So we have integrations with kind of most of the EPRs kind of out there, or capabilities to kind of have that integration if required. So what that would mean is that all of your patient demographics and information that sits and lives in the EPR would then be available to you in Isla to use, and then anything that you're then collecting within Isla, patient reported or clinician reported, would then be pushed back into your EPR. So it just means that we're keeping that kind of constant streamline flow with the different systems that need to be used, and they're all used for a reason, but we're not adding different kind of more tasks and making it something extra for the clinician to do.
No, absolutely. So that brings us to the question that I'd like to ask all three of you. Sorry, Dee, was there something that you wanted to add on to that?
Yeah, sorry, I was just going to say it's actually taken steps out of the duplicating, because up to now, when we've actually wanted to submit a photo or record something in the patient's records, it's actually been a long-winded process to actually achieve. The staff have had to take a photo, come back to base, download the photo, seek advice. Whereas actually with Isla, it's a one-stop shop. You take the photo, it's already on system one, it's already downloaded, it's there to be reviewed instantly. So if you're still with the patient, you can take a photo, upload to record, I can be in base, I can review that photo there and then, and give the staff member who's with the patient advice straight away in a one-stop shop. There's no delay, which has actually saved time rather than increased problems.
That's fantastic, and obviously, great to hear your perspective as well on how you found the tech. The question that I'd like to ask all three of you is, if there was one key insight or takeaway from this discussion or on the topic of supported self-care, what would you like the audience to go away with as that one key message? Steph, could I start with you for that one?
Just I hope you walk away from this and start to have a different view on self-care or self-management, and not see it as a scary thing that's been brought in, because actually it's really important to the people that we care for, that we do this, and it isn't scary. So then my one thing is just to kind of understand it a little bit more and not think it as a hurdle, and actually you're enhancing the care that you can deliver to individuals across the country.
Brilliant. Charlotte, what about you?
I think what I'd like everyone to kind of leave with the thought in place is, I think something that I've really learned in kind of being on this journey alongside Steph and along with our kind of clinical and operational partners such as Dee, is that I think we can make a real positive impact across community services and the care delivered for patients if we harness the power of working in partnership to deliver models such as supported self-management. So bringing together experienced change leaders in self-management such as Steph with the passion and energy to impart the knowledge in this space, alongside our incredible clinical and operational teams who are kind of day-to-day responsible for delivering the best care for patients, whilst at the same time, having the huge stress of running their services effectively, together with a technology partner who kind of shares the same goals and the same values, so we can really then together bring this pathway to life and really enable adoption and scale of supported self-management, and bring it to as many patients and as many kind of partners as possible.
Fantastic, thank you. Dee, what about you? One key takeaway?
I think mine's very much like Steph, let's give our staff the permission to empower these patients. Let's promote it from wide and far across the country that, it is okay to self-care. It is okay to get these patients to self-care. And let's support them to have the best pathway and best treatment they can have.
Brilliant. One of the questions that has come into the chat that I thought was quite interesting was, are there any particular services or pathways that you think are particularly well suited to this approach? Dee, would you be well placed to answer that one with your experiences?
Yeah, everyone, anything, doesn't matter what it is. And I did see in the chat there was somebody said, oh, how does it affect insulin management? Somebody can send us a picture of their readings anytime they like. You know, if they're concerned about their insulin readings, they can send us a quick picture of their BM machine and just say, you know, I'm going up and down each day. So it's any service. We use it in podiatry, we use it in MSK, we use district nursing, catheter clinics are using the facility because they're recording the outcomes, the urine analysis, they're recording anything there that they can to use it for. So that absolutely any service could use it.
Brilliant, thank you. We've had a couple of questions that are sort of generally asking about Isla's plans for the future, I guess. So, for example, do you have any KPIs enabling you to use the data to pinpoint areas for improvement? Then somebody else asked about any kind of feedback from patients. So, Charlotte, would you be able to share some insight on what Isla's hoping for in the future?
Yeah, absolutely. So we're what we can do now already in response to that question is we have a kind of fully configurable reporting kind of system within Isla. So everything that we're kind of collecting metrics wise, we can then, you know, use that to inform what's happening across services, down to individual patients, you know, kind of broadly across there. So that works so brilliantly in supported self-management, especially if organisations are at the very start of their journey, where we're trying to understand, you know, what the impact might be, track the benefits and see what's working, what's not working. So we can see that really, really lovely live within a kind of beautiful view within Isla there. So as I said, that's all completely configurable, and you can also pull that data out and put that into, you know, different reporting systems that you might have within your organisations. And the kind of the part around how do patients find it and some of the kind of feedback in there. So that's something that we're hugely passionate about, and we're kind of always making sure that we're, you know, we're gathering and finding sharing as much as possible what the patient experience is. So we have patient kind of experience response rates of, you know, anything between 4 to 4.75 out of 5, which is really fantastic. And we're really kind of on top of as much as possible, trying to make sure that we're always understanding that patient feedback piece. But we also then get to link that in with our clinicians and our clinical teams as well. So we stick really, really closely, you know, when we're kind of delivering and supporting organisations with Isla to make sure that the pathways that we're kind of running are working for everybody, the patients as well as the clinicians. And then looking into the future, it's always a busy old time at Isla, and that's because we have a real great kind of partnership with everybody that we're working with to kind of continuously be developing the platform in line with what our kind of partners, clinicians, and operational leads are sharing with us. So we have this kind of really lovely co-development type model where, you know, we'll all kind of come together and go, brilliant, what's working, what can we change, and we kind of then develop that further. So that's kind of always ongoing. But the piece around supported self-management has been completely co-developed alongside Steph, who's been kind of brilliant within that space to bring all of the information and learnings that Steph kind of has. We've been able to really then kind of drive that into how can we make the supported self-management kind of aspect within Isla, you know, as beneficial to as many people as possible.
Fantastic, thank you. We've had a question coming in asking what percentage of community patients do you think could potentially be switched over to self-care? And I guess the wider question there is the impact on the NHS, the wider impact there. Would any of you, I'm not sure who would be best placed to answer that. Would anyone like to take a stab at guessing the percentage? Steph?
No, so I wouldn't like to say percentage. But what I will say is I think we've got to bust this myth around self-care. So it doesn't necessarily mean an individual has to completely do the whole of their care themselves and be independent at the end. What it can do is can enable somebody to simply change your dressing one day, but we'll go in another day, as Dee said earlier, or do your blood sugars, but we still need to monitor your insulin, or there are certain aspects of care that somebody can be empowered to do, but it doesn't need to be the whole of that care. And sometimes it's not safe to deliver all of that care independently, but they can do aspects of that, which then will have an effect on critical scenarios, wherefore we could hopefully avoid hospital admission a lot sooner, because what we're doing is trying to give the education to the individual rather than the staff and that individual's long-term condition becomes theirs again. So I think it's really hard to put a percentage on when we talk about self-management, self-care, because actually everybody can do an aspect of it. So that would be 100%. But you know, it's quite hard to determine that, but just to make sure that obviously self-management can be an element of the care, not just all of their care.
Great answer, thank you. And then quite a nice question to wrap up the session with, Charlotte, one for you. How can Isla adapt and evolve to meet the changing needs of self-care and the healthcare system?
Absolutely. So great question. And I think there's always so much that we can do. But I think we've got a real great start on it already. And that's by bringing together a team like on our panel today to really understand what's actually out there happening in clinical practice, what are the real stresses and strains, and then to bring, you know, the experience of Steph and the kind of Steph's model, and how do we then drive that into the technology. So we're always making changes within Isla's technology in response, I suppose, to what we're learning. So I really think, you know, continue with that model. It's working really well, and I think it's our absolute best resource of understanding the direction that we need to go with Isla's technology, and kind of bringing in the patient voice around the table to that too. So I think we'll just be, you know, very much continuing kind of that journey that we're on of that real co-development piece.
Fantastic, thank you. Well, we're coming up to time now, so I'll wrap up the session there. Just to say thank you so much, all three of you, for joining us, and thank you for bearing with us through technical hitches to the audience and for sharing your views and comments and questions. That's really appreciated. As I mentioned at the start, the session has been recorded and a write-up will be shared on HTN's website, so you will be able to go back and reflect on the discussion if you'd like to and share with your colleagues. So I will conclude the session there. One more chance to say thank you to everybody and enjoy the rest of your day.